Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi friends, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Tabitha Uitenbroek, who's a board-certified family nurse practitioner and the owner of Loyly Family Practice based out of Appleton, Wisconsin. Since Tabitha was young, her mom recognized her as a natural caregiver, so it was no surprise when she became a certified nursing assistant in her teen years. After later finishing nursing school, she spent 13 years in hospital-based nursing, gaining experience in surgical care, orthopedics, and emergency care. Eventually, she felt too helpless within the corporate machine and wanted to be able to help patients on their own terms, so it became clear that pursuing additional training to become a nurse practitioner so she could start her own independent practice was next. Tabitha opened Loyly in 2022 and is now locally known as a patient-centered provider who beautifully balances traditional medicine with a holistic approach. She loves what she does and often says, "I'm here to stay because God has planted me squarely in this place." Tabitha is married to her husband, Andy, who's a freelance graphic designer, and she's a mom to 2 amazing boys, Oliver and Leaf. Tabitha and her husband creatively homeschool between both of their workloads, and as a family, they love to travel together. We recommend listening to this 4-part series in order, as many of the episodes reference prior episodes from the series. We had fun discussing some higher-level topics, like the importance of choosing a patient-focused healthcare provider in Episode 1, and why self-pay is smart even when you have insurance in Episode 2, along with some life application conversations, like how to take a preventative approach in your family's health journey in Episode 3, and preventative medicine, which labs should you get and when, in Episode 4. Okay, friends, get ready to learn a lot from Tabitha. I sure did. Let's dive into today's conversation. Hey, everybody. Welcome to the podcast. This is Britt talking, and I'm going to be leading you through a 4-part series here with Tabitha Uitenbroek from Loyly Family Practice. We're going to be diving into some awesome topics in these episodes. Unfortunately, Drea was not able to join us for these 4 episodes, so I'll be leading you through getting to know Tabitha and gaining some of her knowledge. But Tabitha, to start with, in our first episode here, we always love to learn a little bit about our guest. So what can you share with the audience that is pretty interesting for you?
Well, I think people are normally surprised to hear that I used to have a real problem with blood. So as a kid, if someone would be injured or if my mom would talk about health stuff, I would get really creeped out and usually pass out or close to it at the first encounter with blood. So I had to do some work to desensitize towards that. And now it's probably a top favorite.
Well, now I have to ask because I have a phobia of needles specifically for me. How did you get over it?
My mom sent me to the hospital to watch IV draws or IV starts and lab draws. And I just had to keep sitting in the hallway and take a minute and drink some juice and over and over.
Oh my goodness. I don't really want to do that, but I might have to.
It was totally worth it. It changed my trajectory and took out that ick factor.
Yeah. Awesome. Well, that is a fun fact, especially since now you're dealing with blood all the time. I mean, blood draws and things like that. So awesome. Well, I'd love to just start with your story. You have a pretty awesome story. And I loved how when we were talking about your journey ahead of time, you really give your mom a lot of credit for encouraging you to get into starting with the nursing field. Why don't you tell us a little bit about your story?
Yeah. My mom's a nurse, and she was also a homeschool mom to me and amazing homemaker for our family. And so we had a lot of time to converse and experience life together. And so she saw me as a caregiver. I think she instilled those traits in me, the whole nurture versus nature. Definitely a heavy influence of both from her. And we volunteered together, and she ran blood drives and all of that kind of thing. And so I had an early appreciation for the true origin of nursing, I would say. So as I got into those later teenage years, she encouraged me into CPR and lifeguarding and eventually to become a nurse's aide. And then I saw what it was like to really have that human connection and be able to care for another person. That's really a privilege. And it's been that view of mine for always. And she instilled that in me. So pursuing nursing school was her idea more than mine. I just was ready to move on to the next chapter. I was pretty comfortable with whatever that would look like. And so she helped me make that decision and steered me that direction. And then as I went through the journey, it just became more apparent that it was who I was meant to be.
Awesome. And then you started out in like a major hospital system?
Yep. I went to school in Chicago and it was way too expensive to stay there. And to my parents' satisfaction and gratitude, they were glad I decided to move to Appleton closer to them. And I got a job with Theta Care right away. So I worked in orthopedics first. And then I transitioned into the recovery room, which was a highlight. I loved waking people up from surgery. And it's a very independent form of nursing because you're really just making sure that that patient is waking up well, that their pain is under control for that first 1 hour after surgery. And I loved that acute care. And then I transitioned into more of a leadership position within surgical services, and then ultimately took over the trauma program for Theta Care for the last 10 years of my time there.
Okay. And then, so now you own an independent practice, Loyly. So what made the transition happen?
As you and I have discussed, very divine intervention. It was not a dream, a lifelong dream to own a business or to be an independent family nurse practitioner. I knew I was called to be a caregiver, as we've covered, but I did not have this in my mind as a future endeavor. So in 2020, a lot of the world changed. Before all of the COVID lockdowns had started, I had already made the decision to pursue nurse practitioner training. But then as I saw care during COVID, it became more apparent that we needed independent healthcare providers.
And then Loyly was born.
Mm-hmm. Exactly. A little bit of necessity, but mostly out of divine intervention.
Yeah. A little nudge from God telling you, I have more for you. Yeah. Awesome. So you consider yourself a patient-focused healthcare provider. What does that mean? Can you define patient-centered for us?
Mm-hmm. It is a buzzword often used in healthcare. So I've been hearing that in my corporate trainings for the last 20 years. I've seen it on all the billboards in every city that you go to. Every hospital system claims to be patient-centered, but what does that really mean? And is there autonomy to be able to actually follow through on that commitment? So to me, it means the patient or the parents are the ultimate decision makers for their healthcare. And so that means options. That means here's what I see, here's what I think, here's what I recommend. What do you see? What do you think? What are you most comfortable with starting for treatment or even for diagnostic testing?
So it's a relationship almost with the family where they get to have a say in choices. So you're more informing them and then allowing them to make choices based off the information.
Right. I would argue that there's few people in this world who would say we aren't all unique. And that comes to our mindset. It comes to our life experiences, our faith, the way our bodies process medication or foods or exercise. We're all unique. And how can we, as healthcare providers, insist on one thing for a person without their full conversation around that?
Yeah. Yeah. So with you said it's kind of a buzzword. You see it everywhere. So you probably see it on hospital system billboards and stuff too. So how does that relate to the hospital system?
I see it on the billboards, but I didn't see it in practice. So that doesn't mean there aren't wonderful caregivers who work in every healthcare setting across the board, but it means that they may be really restricted in their ability to act that way when they're caring for a patient or making decisions for the patient.
Now, do you have an example of that? Because I think when we were talking earlier, you had mentioned you had recommended a parent try like an Epsom salt bath for something and you were reprimanded. Can you share a little bit about that story?
Right. Well, in healthcare, evidence-based practice guidelines are the mainstay. So if you recommend an antibiotic for a certain infection, it needs to be proven in evidence that that's the right antibiotic and will give the intended outcome. I agree with that concept. At the same time, there's a lot of interventions that you can do for your health that don't have evidence. Maybe they haven't been researched because there's no money behind them. Maybe it's a mainstay in other countries, but we just haven't adopted it here. So I have found in the past, the Epsom salt thing is kind of a lighthearted example, but in my pediatric training, there was an opportunity to offer that to a parent for a kiddo that was having really bad leg aches, and it worked great for my kids. It's a magnesium, a great way to soak in some magnesium into the muscles. And leg aches or growing pains aren't widely researched. We don't really have a solution. They're not really about growing. And so I offered that as a potential resource for the patient. And when we exited the room, I was reminded that I am not supposed to be providing any non-evidence-based suggestions to families. And that just was right in my face of, wait, but if it's going to help and it's not going to hurt, why can't that be an option? Why can't we offer things that could be supportive?
Yeah. So you probably felt a little handcuffed in that moment where you were like, okay, so what was I supposed to say? You're telling me for this specific symptom or leg pains or growing pains are the issue this family is dealing with. I'm only supposed to say these, set of
ibuprofen.
That's it. Like
Right.
that's okay. And basically anything outside of that scope that would be maybe more naturally based or things that you could try in your home are not approved things to share.
So yes, I felt handcuffed, but at the same time, it felt like a little fuel to my fire of, oh, I can't do that? Okay, well then I'll just go do my own thing. So I've made that choice to take each of those roadblocks, barriers, restrictions, instead of feeling frustrated and constricted. I just thought, well, I'm just going to go outside of those boundaries then.
How far into your 13 years was it where you started kind of getting that roll in your stomach being like, something's not right here. I don't feel like I can give all the advice that I know would be beneficial for this family?
I'm going to reframe that and say, how far into my bedside nursing experience did I realize that the rules weren't always there for the patient benefit? That's a great question. I haven't thought about exactly when, because most things in life are a smooth transition. Probably when documentation went from paper to charting in a computer, and it became about check boxes. And I realized that the emphasis was on, did you check the appropriate boxes at the right interval of time, or how's your patient doing? It totally switched. So that was probably in year 3 or 4.
Was that an insurance-driven switch or more of a hospital policy switch?
Yes, all of the above.
Oh, okay.
Yeah.
We're going to be talking about insurance in episode number 2, so we'll dive into more of that later. But I want to circle back to, you had talked about clinical practice guidelines. What are clinical practice guidelines based on?
They're based on evidence-based research, which is based on whoever decides to do that research to support or contradict a certain position. So when I was working with the trauma programs for Theta Care, I remember specifically teaching a class with one of our surgeons who I really loved working with. And he was a great patient advocate and really good. And I was challenging him on one of our quality metrics. And he said, is that based on what's right for the patient, or is that based on what the guidelines say? And I said, well, the guidelines, but that's what we follow, especially in trauma care. It's all about do this by this point of time, and then the next intervention. It's all written very structured. And he said, well, that's great, but that's written for the worst case scenario, for the least comprehensive trauma center, for the the least resources. We can do better. So why wouldn't we do better? I said, oh, okay. We have the ability to say we can do better. And it changed my thinking. So that was probably 2017, maybe. So a while ago. So clinical practice guidelines are made to give the safest potential outcome based on what we know in research, but it's also for the least accountable family, let's say, the least access to resources. It doesn't mean it's the best and only.
Okay. Is there a certain level of research that's required before something becomes a guideline? So what, there's all these peer-reviewed studies and all these, and you said a lot of that is probably driven by demand and or money available to do the research. But at what point does it become a guideline?
When a recognized governing body, accrediting body accepts it. So they would have a leadership team that would decide this is our new standard. So when you think of American Heart Association, they set the standard for CPR. They set the standard for statin therapy for cholesterol. They set the standard for screening numbers for blood pressure, for calcium scores of the heart. And there's many other organizations like that.
So now you, in your own independent practice, what guidelines do you need to adhere by and have those check boxes versus how much are you able to give your patients individualized care?
I'm accountable to be aware of the evidence-based guidelines and clinically accepted practice guidelines. And so I'm aware of those and I do share those with patients. However, at the same time, I say, okay, you tested positive for strep throat, let's say. The clinical practice guideline would be 10 days of amoxicillin penicillin, or Z-Pak would be the second choice. I do support treating that with antibiotics. I'm concerned about the long-term risk of an untreated strep infection. So that is what I would recommend. Other people choose to do, high-dose herbal antibacterial agents, lots of saltwater gargles, lots of time, lots of fluids, rest, red light therapy. So patients have that liberty to choose, and they should in every environment. They just may have more of that conversation with me versus, oh, you have strep, here's your prescription that you might get at another place.
Yeah, and that helps us to understand a little bit more about that patient-focused that you talked about in the beginning. So, pretty much everybody has an established provider, whether it's you or whether it's a pediatrician for their kids or if it's just a general family practice provider. In general, we know that they are highly educated. So I feel like as a parent myself, if I were to go to a doctor with a concern, whatever answer they give me, I'm going to kind of treat it as gold and put it on a pedestal because they're so much more educated in this scope than I am, even someone who is interested in health and wellness. So what if your provider responds negatively to whether it's a question about a side effect of antibiotics or a necessity for a specific test or maybe some reluctance to a specific intervention? How should I, as a not nearly as highly educated in this scope individual, respond in a respectful way?
It should be a red flag to the consumer or the patient if there's a negative perception when there's questions asked or when a suggestion is given. That would be concerning to me. That's not a patient-centered provider at that point. So how could you respond? I have heard recently a lot of times no is a complete sentence. I generally like to be a little softer. Oh, thank you. That doesn't sound right for my family. But it's okay to have that dialogue. So if a patient is feeling like the recommendation isn't in the best interest of their child or for themselves, a respectful response could be, we're all individual and that just doesn't sound like a good match for me. So I'd like some other options, and then see how that's received.
Okay. So really just asking questions, right? And then just seeing how they respond to those questions.
Right. You and I, Britt, have talked about power dynamic in healthcare. And so you mentioned if it's an educated physician or a nurse practitioner or PA, that's great. We all have expertise in different areas, but that doesn't mean we can't have a human dialogue. It's about our health. That's the reason that we go to the doctor's office. And that's the reason we seek help if there's an ailment or we want to do wellness and make sure that things are on the right track. It's still a human connection. And so we should be able to have that equal dialogue.
Yeah, I love that. I love that thought. It's the whole, we all put our pants on with one leg at a time
Right,
thing,
right.
right? Well, and I think that's actually really relatable to parenting too. I think about with my kids, if I need to have a conversation with them, it's much better for me to get down on one knee and get to their level and to kind of take away that authoritative feeling of being over them. And I mean, it would help them feel that same way. So I kind of look at that as a similar situation where there's probably someone who is a little bit higher in authority for making a decision, maybe not the decision, but giving recommendation. And you really, as a patient, you feel so much more included when they're talking to you at the same level. Yeah.
It's like showing your work for math,
Yeah.
Yeah.
So if someone feels like their current provider is maybe not a good fit or maybe not truly patient focused and they kind of want to go and shop around and maybe interview some different providers, what are some good questions to ask to know if that provider is patient focused within their philosophy?
So one example would be to ask them, if you provided me a recommendation for my healthcare, do you have the independence to be able to do that? Or do you have corporate policies, metrics for your clinic, restrictions that would be placed on how flexible you can be with me for my healthcare, for my child's healthcare? More specific questions would be, how would you handle strep throat? How would you handle a skin infection? How would you handle, various different things that may be in your historical record? Ask them how they would handle those things. I have taken phone calls like that from families who just want to talk about, how would you approach my kid? They're really nervous about coming into an office visit, or, my husband is really reluctant to have a physical. How would that go with you? What does that look like? I've had patients call and ask those kind of questions, and I'm open to that. I don't know that you can have that accessibility in a lot of places, but you could certainly do a new patient visit and just come with questions.
Yeah, and I like to think that the majority of providers, it's not necessarily going to be their personal philosophy. Like, they all have your best interest in heart, right? And some of them are probably going to have more of a natural mindset of maybe doing some research on alternative medicine and maybe, not always following exactly what they learned in school, of knowing that there's more options out there. So I'm guessing that oftentimes, especially in a major hospital system, it's more that their hands are tied with what they can offer, like what we talked about before.
Mm-hmm. But channeling my husband, he would say they still have a choice, then they need to go elsewhere if they really do have your best interest, which is a strong statement, but we lived it. So it's easier for us to say that. We have a wonderful family physician that my boys have seen since they were born, and we go annually. They don't need anything. They're healthy and well, but I like having someone else's eyes on them just to make sure, because it's kind of hard to assess somebody so close to home. And he has never put us in a position of feeling pressured or cornered. Consistently, he'll tell me, hey, I listened to a new podcast on this new intervention. Did you hear that? What do you think? And we have dialogue. And that was long before I went back for my nurse practitioner. And I don't even know that he knew I was a nurse early on. And so you can have that in mainstream medicine.
Well, it's a good example of patient-focused.
Yes.
Right?
Mm-hmm.
And my family sees you. I think you're amazing, and you're patient-focused as well. And so if people listening to this want to connect with you, where can they find you?
Mm-hmm. Starting at the website, so loylyfp.com, LOYLYFP.com. Otherwise, I respond to emails and texts. I don't have any staff. It's just me, which has been wonderful. I did not expect that. I thought I'd need to hire some help by the first year. I have enough business I could, enough patient business, pretty hopping usually, but I like to be that source of contact. I don't want to put somebody else in between, because then I lose a good amount of that connection with patients.
I feel like that's such a good point too, because everybody craves the old school doctor where you could just call and talk directly with them, and you offer that. So that's incredible.
Yeah.
Thank you for joining us on this episode, and we'll be back with you guys for episode 2. If you enjoyed this episode, would you consider leaving a rating or review, or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.